Now, Louise, you've written a lot about HCl over the years and its role in digestion. What have you learned? What is your viewpoint now?
Good question. I don't think things are as black and white as I once thought, and I only say that because of my own personal experience. What I'm finding, because of the way in which we sit, hunched over our computers,
yes,
you know,
in our cubes,
right, in our cubes or in our cars, that a lot of people have some structural problems with regard to the digestive processes because of a hiatal hernia syndrome. And because I myself...
Is that common?
It is exceedingly common.
Wow.
It's exceedingly common, and most doctors don't pay attention to it, but I have seen an enormous amount of dysfunction and uncomfortableness. That really, discomfort is the word that I'm looking for, that are associated with this. The inability to take a full breath. We see GERD as being one of the primary examples of a hiatal hernia. So it isn't a lack of or too much acid or not enough acid, but the problem is that poor little stomach is going through the diaphragm. Sometimes it can slide in and out. There are two types of hiatal hernias. And therefore, you're feeling all of those digestive acids in the esophagus, whereby they shouldn't be splashing all the way up there. But that's because of a structural abnormality. So the thing that I'm telling everybody, because we do believe that 94% of all GERD patients have a hiatal hernia, is that you use some self-health techniques at home to push that little baby down so that your stomach is actually down south where it belongs and not riding high into your chest.
So that's what's happening? Your stomach is riding high in the chest?
In the chest. Some people feel as if they're having a heart attack and they're rushed to the emergency room, which is why we're finding that digestive ills are the second most important reason that people are going, you know, for urgent care. What I tell people to do is to use your hands and then to take a deep breath and start pushing down any little knobs or any little bumps until you start feeling gurgling in that stomach. You just put your little hands right over here towards the left, and you start pushing down gently so that you'll hear my stomach gurgling in a second. You start pushing it down until you hear almost like a little pop, and sometimes little adhesions break. But this is so prevalent among individuals that I'd be remiss if I didn't tell you that I don't think you should be doing an HCl test unless you know that you do not have a hiatal hernia, because you will become very acidic where it'll be discomforting, and you don't want any kind of corrosion or irritation going on in the esophagus.
So just push down until you hear the gurgling.
You push down until you hear the gurgling, or you can take first thing in the morning at least 2 big glasses of water, get on that mini trampoline that's so good to start removing the, giving your lymph a full workout, and we'll start flushing out any of the toxins and some of the overloaded water that may be held in your tissues. And that will also start to bring the stomach down, just jumping on it for 12 times.
12 times, and you'll push
pushing this down. Deep breath, let it out, and keep following that breath all the way down until you hear that gurgling, and then you can feel the stomach almost dropping into place. But it's really prevalent. It's prevalent to the extent that a lot of people have anxiety because of it. They have tightness in their ribs, tightness in their back. I'm thinking of all my symptoms that I had until I figured this out. And so even seeing a naturopathic physician, sometimes even a chiropractor that can do the adjustment, it's a soft tissue adjustment, can be life-saving. So I don't think anybody has to have discomfort because of this. Now what happens is sometimes the valves remain open, and until the stomach is down, they're not closing properly. You know, and there's some surprising elements about foods that I learned because of this whole hiatal hernia syndrome. And that is that there's certain foods that can keep important valves open rather than closed. And one of them was my favorite food, which is onions.
Onions?
Particularly raw onions, yeah. It can be very, very irritating to the lower esophageal sphincter, the LES, which should remain closed so that nothing can be splashing up into your esophagus. And when that remains open, chances are it's because not only because of the structural abnormalities that I'm talking about, but because you're eating too much of the onions, too much of the mints, whether peppermint tea or spearmint tea will actually loosen that valve. Now, this is interesting because we think that's good for digestion, but it will keep the valve too relaxed. And chocolate and coffee and alcohol. And those are all elements that I reduce in my program. So I was kind of delighted to find out, but that may be, you know, an impinging factor on your digestive processes. So those are things that we should not take in if we've got digestive problems and we know that the discomfort is someplace in the middle, upper chest, or lower left quadrant.
Okay, so chocolate, coffee, and alcohol will contribute to this too.
Well, they'll make that sphincter, the lower esophageal sphincter, the LES, weaken, which is a muscle, and it will weaken the muscle tension. So to keep that nice and taut and tight, so we can keep your stomach acid where it belongs, you're going to want to lessen your intake of those particular foods. And the interesting thing is, Raina, as you and I both know, chocolate is the food of the 21st century. I mean, chocolate is good for everything. Well, it's not good for your sphincter and your muscles and your digestion. And it's a high source of copper, which is another topic that I hope we discuss.
Okay. Well, what about the wine, you know? The resveratrol and everything, you have wine with your meal, the alcohol is going to irritate this?
Alcohol can be very irritating. I mean, a little bit isn't going to be a problem. When we take 1 or 2 glasses a night, you know, then I think we've got problems. And you can't get enough resveratrol in 1 or 2 glasses of wine. I mean, those are
5 bottles.
Sounds good to me, but not good for your LES, not good for your muscles and your digestion, and that ultimately will be impacting this hiatal hernia syndrome, which is something that I think people really need to look into.
I think so. And then the coffee, is it the caffeine or the acidity?
I have a feeling it's the acidity, because what people don't recognize, it's highly acidic. And if you drink a decaf coffee, they choose the more acidic beans to kind of substitute for the lack of caffeine. So you need more taste value. That becomes more acidic. Yeah, so you really want to be careful. And alcohol, we know, is acidic.
Right.
Chocolate, I'm not sure what the mechanism is there, but I can tell you that that is definitely one of the all-time worst foods for them.
Well, the sugar would make it acidic. I mean,
and excessive amounts of sugar too, which is the most acidic of all.
Thank you, Ann Louise.
You're welcome.